Have you ever wondered why your arthritis pain seems to be getting worse despite taking multiple medications? Why does it feel like every morning brings new stiffness, new aches, and that burning sensation in your joints that just won't go away? You wake up, take your prescribed pills, maybe add an over-the-counter pain reliever, and yet by afternoon you're struggling to open a jar or climb the stairs without wincing in pain. Here's something that might shock you. It's not always because your arthritis is naturally progressing. Sometimes, and this is the part that very few doctors will openly discuss with you, it's because the very medications you're taking to help your joints are actually working against each other. They're creating a silent war inside your body, and your joints are paying the price. You see, when you're over 65, your body processes medications differently than it did when you were younger. Your liver works slower, your kidneys filter less efficiently, and your metabolism has changed dramatically. What this means is that medications that might work perfectly fine individually can become dangerous enemies when combined in an aging body. The pharmaceutical companies know this. Your doctors are aware of it, but somehow this crucial information rarely makes it to the people who need it most. You, the person taking these medications every single day, trusting that they're helping, not knowing that certain combinations might be silently inflaming your joints, weakening your bones, and making your arthritis symptoms significantly worse. Today, we're going to expose the 5 most dangerous medication combinations that are secretly sabotaging your joint health. These aren't rare exotic drugs. These are common medications that millions of seniors take every day, believing they're doing the right thing for their health. But when combined, they can turn your body into a battlefield where your joints become the casualties. What I'm about to reveal to you in this video could be the missing piece of the puzzle that explains why your arthritis feels like it's getting worse instead of better. For the past 3 decades, I've been studying the complex interactions between medications and how they specifically affect the aging body. What I've discovered is alarming, but more importantly, it's actionable. The truth is, there are 5 specific medication combinations that are being prescribed to seniors every single day, and these combinations are creating a perfect storm of inflammation in your joints. They're not just failing to help your arthritis, they're actually making it worse. Much worse. Think about it this way. Imagine your body is like a delicate ecosystem, and each medication you take is like introducing a new species into that ecosystem. When you're younger, your body's ecosystem is robust enough to handle these introductions. But as we age, that ecosystem becomes more fragile, more sensitive. And when certain medications are combined, they don't just coexist peacefully. They compete for the same resources, they interfere with each other's functions, and they create toxic byproducts that your aging body struggles to eliminate. The result? Your joints become inflamed. Your cartilage breaks down faster, your bones weaken, and that arthritis pain that you've been trying so hard to manage becomes a daily nightmare that affects every aspect of your life. But here's the encouraging news. Once you understand these dangerous combinations, once you know what to look for and what questions to ask your doctor, you can take control of your joint health again. You can work with your healthcare provider to find safer alternatives, adjust dosages, or change the timing of when you take certain medications. This isn't about stopping your medications. This is about being an informed patient who understands how different drugs interact in your body and how to optimize your treatment plan for better joint health. Because you deserve to live without constant pain. You deserve to wake up feeling mobile and comfortable, and you deserve to know the truth about what might be causing your arthritis to feel worse. Before we dive into these 5 dangerous combinations, I need to know that you're with me on this journey. If you're someone who's been struggling with worsening arthritis pain despite taking multiple medications, I want you to type the number 1 in the comments right now. If you're watching this because you're concerned about a loved one who's dealing with this issue, type the number 2. Your engagement helps me understand who's watching and what kind of content serves you best. And please, hit that subscribe button and ring the notification bell, because the information I share on this channel could literally change your quality of life. I don't just talk about health topics for entertainment. I dig deep into the research, I speak with leading specialists, and I bring you information that could save you years of unnecessary suffering. Also, I want you to know that everything I'm about to share with you is based on peer-reviewed medical research and the clinical experience of geriatric specialists who work specifically with patients over 65. This isn't opinion or speculation. This is documented science that every senior deserves to know about. So grab a pen and paper, because you're going to want to write down these medication combinations and discuss them with your doctor at your next appointment. Your joint health may depend on it. First dangerous combination: blood thinners and anti-inflammatory medications. The first combination that's silently destroying joints in seniors involves blood thinners like warfarin or newer medications like rivaroxaban, combined with anti-inflammatory drugs such as ibuprofen, naproxen, or even prescription NSAIDs like meloxicam. Here's what's happening in your body when you take these together. Blood thinners work by interfering with your body's natural clotting process. They're essential for preventing strokes and heart attacks in many seniors. But when you add anti-inflammatory medications to the mix, you're creating a dangerous situation that goes far beyond the well-known bleeding risk. Anti-inflammatory drugs, especially NSAIDs, interfere with the production of prostaglandins. Now, prostaglandins aren't just involved in pain and inflammation. They also play a crucial role in protecting your stomach lining and maintaining healthy blood flow to your kidneys. When you combine blood thinners with NSAIDs, you're not just increasing your risk of bleeding, you're also reducing blood flow to the very tissues that your joints need to stay healthy. Think of it this way: your joint cartilage is like a sponge that needs to be constantly bathed in nutrient-rich blood to stay healthy. When blood flow is reduced, that sponge starts to dry out and crack. The cartilage becomes brittle, more prone to damage, and less able to cushion your bones during movement. But there's more. This combination also interferes with your body's ability to repair damaged joint tissue. When you have arthritis, your body is constantly trying to repair and rebuild damaged cartilage and bone. But the combination of blood thinners and anti-inflammatories creates an environment where this repair process is significantly impaired. Many seniors don't realize they're taking this dangerous combination because they might be taking a prescription blood thinner from their cardiologist and buying over-the-counter ibuprofen for their joint pain. They assume that because one is prescription and one is over-the-counter, they're safe to take together. This assumption is costing them their joint health. Second dangerous combination: proton pump inhibitors and calcium supplements. The second combination involves proton pump inhibitors. Medications like omeprazole, lansoprazole, or pantoprazole that reduce stomach acid, combined with calcium supplements that many seniors take for bone health. This combination is particularly insidious because it seems like it should be beneficial. After all, you're taking medication to protect your stomach and supplements to protect your bones. But here's the hidden truth that's damaging your joints. Calcium absorption requires an acidic environment in your stomach. When you take proton pump inhibitors, you're dramatically reducing the acidity of your stomach. This means that even though you're faithfully taking your calcium supplements, your body isn't able to absorb them effectively. You're essentially flushing expensive supplements down the drain while your bones and joints suffer from calcium deficiency. But the problem goes deeper than just poor absorption. When calcium isn't properly absorbed, your body starts pulling calcium from your bones to maintain critical functions like heart rhythm and muscle contraction. This process, called bone resorption, doesn't just weaken your bones. It also affects the bone structure around your joints. Your joints rely on strong, healthy bone to provide stability and support. When the bone around your joints becomes weakened due to calcium deficiency, it can't properly support the joint structure. This leads to increased wear and tear on your cartilage, more joint instability, and ultimately worse arthritis symptoms. Additionally, poorly absorbed calcium can actually contribute to inflammation in your joints. When calcium isn't properly utilized by your body, it can form deposits in soft tissues, including the tissues around your joints. These calcium deposits can trigger inflammatory responses that make your arthritis pain and stiffness significantly worse. Many seniors are taking this combination without realizing the connection. They take their proton pump inhibitor in the morning for acid reflux, and they take their calcium supplement with dinner, thinking they're covering all their health bases. But they're unknowingly creating a situation where their joint health is being compromised. Third dangerous combination: diuretics and arthritis medications. The third dangerous combination involves diuretics, commonly called water pills, such as hydrochlorothiazide or furosemide, combined with arthritis medications, particularly disease-modifying anti-rheumatic drugs or DMARDs like methotrexate. Diuretics are commonly prescribed to seniors for high blood pressure or heart conditions. They work by helping your body eliminate excess fluid and sodium. While this is beneficial for cardiovascular health, it creates several problems when combined with arthritis medications. First, diuretics can significantly affect how your body processes and eliminates arthritis medications. Many arthritis drugs, including methotrexate, are eliminated through your kidneys. When you're taking diuretics, you're altering your kidney function and the concentration of these medications in your bloodstream. This can lead to either inadequate treatment of your arthritis or dangerous buildup of medication in your system. But there's an even more concerning issue. Diuretics cause your body to lose important minerals, particularly potassium and magnesium, along with the excess fluid. These minerals are crucial for proper muscle and joint function. Potassium deficiency can lead to muscle weakness and cramping, which puts additional stress on your joints. Magnesium deficiency affects your body's ability to manage inflammation and can make arthritis pain significantly worse. Furthermore, chronic dehydration from diuretic use can affect the synovial fluid that lubricates your joints. Think of synovial fluid as the oil in your car's engine. When you don't have enough of it, or when it becomes thick and sluggish due to dehydration, your joints don't move smoothly. This leads to increased friction, more wear and tear, and worsening arthritis symptoms. The timing of these medications also creates problems. Many seniors take their diuretic in the morning and their arthritis medication at night, thinking they're spacing them out safely, but the effects of diuretics last throughout the day, continuously affecting how your body processes the arthritis medication. Fourth dangerous combination: antidepressants and pain medications. The fourth combination involves certain antidepressants, particularly selective serotonin reuptake inhibitors, or SSRIs like sertraline, fluoxetine, or paroxetine, combined with pain medications, especially tramadol or other opioid-based pain relievers. This combination is becoming increasingly common as doctors recognize the connection between chronic pain and depression in seniors. The logic seems sound. Treat both the physical pain and the emotional impact of living with chronic arthritis. But this combination creates several serious problems that can actually make your arthritis worse. Both SSRIs and many pain medications affect serotonin levels in your brain and body. When combined, they can cause a dangerous condition called serotonin syndrome, but even at subclinical levels, elevated serotonin can have surprising effects on your joints. Excessive serotonin can increase inflammation throughout your body. While serotonin is often thought of as the happy neurotransmitter, when levels become imbalanced due to medication interactions, it can actually trigger inflammatory cascades that directly affect your joints. This means that while you might feel emotionally better, your arthritis inflammation could be getting worse. Additionally, this combination often leads to changes in sleep patterns and physical activity levels. Many seniors report feeling more sedentary when taking this combination, partly due to side effects like drowsiness or dizziness. Reduced physical activity is one of the worst things for arthritis. Your joints need regular, gentle movement to stay lubricated and flexible. When medication combinations lead to increased sedentary behavior, your joint health suffers dramatically. The combination also affects your body's natural pain processing mechanisms. Over time, your body can become less sensitive to its own natural pain relief systems, making you more dependent on medications and potentially more sensitive to arthritis pain when medication levels fluctuate. Fifth dangerous combination: steroids and osteoporosis medications. The fifth and perhaps most damaging combination involves corticosteroids like prednisone, which are often prescribed for arthritis flares, combined with osteoporosis medications such as alendronate, risdronate, or ibandronate. This combination is particularly common in seniors with rheumatoid arthritis or severe osteoarthritis who also have osteoporosis. The reasoning seems logical. Use steroids to control inflammation and osteoporosis medications to protect bone health, but this combination creates a perfect storm of problems for your joints. Corticosteroids, while excellent for reducing inflammation, have significant long-term effects on bone and joint health. They interfere with your body's ability to build new bone and can accelerate the breakdown of existing bone tissue. They also affect the production of collagen, which is essential for healthy cartilage and other joint tissues. Osteoporosis medications, particularly bisphosphonates, work by slowing down the natural process of bone breakdown and renewal. While this can help maintain bone density, it can also lead to bones that are denser but more brittle. These medications can also cause a rare but serious condition called osteonecrosis of the jaw, and there's growing concern about their effects on other bone tissues, including those around joints. When these two types of medications are combined, they create conflicting signals in your body's bone metabolism. The steroids are telling your body to break down bone and interfere with repair processes, while the osteoporosis medications are trying to halt these natural processes entirely. This metabolic confusion can lead to bone and joint tissues that are neither strong nor flexible. Furthermore, both medication types can affect your body's absorption and utilization of essential nutrients like vitamin D, calcium, and magnesium. This nutritional disruption has direct effects on joint health and can make arthritis symptoms significantly worse over time. Now that you understand these dangerous combinations, you might be feeling overwhelmed or worried about your current medications. Please don't panic. The goal isn't to scare you away from necessary treatments, but to empower you to work more effectively with your healthcare providers. The first step is to create a complete medication list that includes everything you take: prescription medications, over-the-counter drugs, vitamins, supplements, and even herbal remedies. Many dangerous interactions occur because different doctors aren't aware of everything you're taking, or because you don't think to mention over-the-counter products. Schedule a medication review with your primary care physician or ask to speak with a clinical pharmacist. These healthcare professionals are specifically trained to identify problematic drug interactions and can often suggest safer alternatives or adjustments to timing and dosages. For each of the combinations we discussed, there are often safer alternatives. Instead of combining blood thinners with NSAIDs, your doctor might recommend topical anti-inflammatory creams or acetaminophen for pain relief. If you need to take proton pump inhibitors, your calcium supplementation might need to be adjusted in timing or type, or your doctor might recommend calcium citrate instead of calcium carbonate. Consider asking your doctor about medication holidays or gradual dose reductions for some medications. particularly if you've been taking them for extended periods. Sometimes, medications that were necessary months or years ago may no longer be required, or lower doses might be equally effective with fewer interaction risks. Focus on supporting your joint health through non-medication approaches as well. Gentle, regular exercise like swimming or Tai Chi can help maintain joint flexibility without putting stress on your system. Anti-inflammatory foods like fatty fish, leafy greens, and berries can provide natural support for joint health. You've made it through some complex and potentially concerning information today, and that tells me something important about you. You care enough about your health and your quality of life to seek out answers, even when those answers might be difficult to hear. The truth is, managing arthritis as a senior isn't just about taking the right medications. It's about understanding how everything in your body works together, how different treatments interact, and how to be an active, informed participant in your own healthcare. Your arthritis doesn't have to keep getting worse. You don't have to accept increasing pain and stiffness as an inevitable part of aging, but you do need to be informed, proactive, and willing to have honest conversations with your healthcare providers about all aspects of your treatment plan. Remember, you are your own best advocate. No one else will fight for your comfort and mobility the way you can. Use the information from today's video as a starting point for those important conversations with your medical team. I want to hear from you in the comments. Have you experienced worsening arthritis symptoms that might be related to medication combinations? What questions do you plan to ask your doctor at your next appointment? Your experiences could help other viewers who are dealing with similar challenges. If this video opened your eyes to new possibilities for managing your arthritis, please give it a thumbs up and share it with others who might benefit. Subscribe to our channel and hit that notification bell, because we're committed to bringing you the kind of in-depth, practical health information that can truly make a difference in your daily life. Your joints, your mobility, and your independence are worth fighting for. Don't let dangerous medication combinations steal another day of comfort from you.